pretty normal and ordinary students who dreamt of making something big in my life. So I started to develop my own targets, my own goals, my own attitude, and whatnot, everything that I can do. In the due course of time, I come across various incidents which made me to think about the healthcare system as well as the healthcare service providers. So let me share some of my experiences which made me to contemplate regarding the healthcare system. The first one, a 45-year-old male who is a known diabetic, hypertensive with coronary artery disease was brought to the hospital with chronic non-healing ulcer over his left leg and later had undergone amputation. The physician then prescribed him 40 mg atorvastatin one time a day for the next 30 days. So immediately when you get some prescription, you go to the pharmacy. At the pharmacy, the patient was given 40 mg rosuvastatin, a different drug from the prescription, stating it as cheap, affordable and accessible. But little the pharmacist knew was 10 mg of rosuvastatin is equal to 20 mg of atorvastatin. So the patient started to take 40 mg rosuvastatin 2 times a day, therefore eventually making it 160 milligrams of atorvastatin, contrary to 40 mg atorvastatin prescribed by the physician. So when you take the overdose, within a few days of time, later he developed myalgia, that's muscle weakness, numbness, the other constitutional symptoms, fatigue, and was brought to the hospital. At the hospital, he had undergone examination, and on the laboratory analysis, it was found out that the serum creatine phosphokinase was 12,870 international units, whereas the serum creatinine was 5.5 milligrams per deciliter. On the second day, the patient passed out only 700 ml of urine. So the physician referred him to a nephrologist. The nephrologist immediately asked his team to have a fluid restriction for the next 3 days. And therefore gradually on the 5th day, the patient passed out only 10 ml of urine. The nephrologist was tensed up and he asked for a kidney biopsy. On seeing the kidney biopsy report, he stated it as and provisional diagnosis as rapid proliferative glomerulonephritis. You call that as RPGN, and immediately he started the treatment. For the next 1 month, he gave different types of antibiotics, different types of treatment regimens, and different types of interventions from time to time. But still the patient condition does not seem to go well. The patient was terribly depressed and he left out the hospital. And after the 2 months of time, the patient was diagnosed by the other physician as rhabdomyolysis, which is statin induced, associated with acute tubular necrosis due to the overdose of rosuvastatin. Now, let me analyze this scenario. Where does the mistake lie? Is this the mistake caused due to the inappropriate knowledge of a pharmacist, or is this the mistake caused due to the failure of noticing of the change in drug therapy by the physician, or is this the mistake of the nephrologist who actually gave a wrong and probable diagnosis? Whatever may be the cause, or whoever may be the individual, the patient has suffered in his mental, physical, social, vocational, economical aspects of his life. Now, the second one. A 25-year-old female came to the hospital and she was detected to be pregnant. During the first trimester, that is during her 3rd month of pregnancy, she was diagnosed. She was not doing well and she started to have severe nausea and vomitings. She had around 5 episodes of vomiting all through the day and she was immediately brought to the hospital. On bringing to the hospital, on examination it was evident clear that the individual or the patient was severely dehydrated due to vomitings, and on the laboratory investigations it was found out that the potassium levels were very low. So the doctor asked her team to administer intravenous potassium fluids. But one of the team members during the administration of these fluids made a very big mathematical error and gave the intravenous fluids. Due to the overdose of potassium levels, within the next 30 minutes, the patient developed arrhythmias, palpitations, numbness, muscle weakness, whatnot, every symptom. And within the next 1 month, the next 1 hour, the mother as well as the fetus dead. This is a very simple condition from which the mother and the fetus could have been saved if the healthcare providers, the nurses, the attendants would have paid some more attention. Okay, what do you call these things? And I call them as the medical errors, which are known to be the submerged icebergs in the sea of medicine. As per the recent statistics, the leading causes of the death in the world are 1. Heart diseases, 2. Cancer, 3. Preventable medical errors, 4. Chronic lower respiratory tract infections, 5. Accidents, and 6. Stroke. So, if cancer and heart disease doesn't kill you, probably your healthcare system or your doctor could kill you. This is not about shame and blame, but this is all about changing the game. Actually, the first practice or the thing for medical error reduction started in 1999 when the Institute of Medicine released its publication called "To Err is Human," which clearly showed the impact of medical errors which started to cost one's life. And in 2018, when an independent survey was done, it is very clear that no evidence reformation was tried to bring in the medical error reductions. The Johns Hopkins study of medicine in America stated that every year 2.5 lakh individuals in America die due to medical errors. As per the Center for Disease Control, it's clear that the heart diseases take 6.2 lakh deaths per year, whereas the cancer 6 lakhs deaths per year, but whereas medical errors 2.5 lakh deaths per year, and the chronic respiratory lower tract infections were 1.5 lakh per year. So let me ask you some questions. Where does the mistake lie? What are the causes of medical errors? And why do we have this significant number of medical errors which are costing one's life? Is this the mistake of the teachers who actually train the doctors? Is this the mistake of the students itself who are the upcoming doctors? Is this the mistake of the education system who failed to bring the best out of the doctors? Or is this the mistake of the healthcare providers? As far as it's concerned to me, I strongly believe that each and everyone has their part in contributing to the medical errors. The teachers, the students, the education system, as well as the healthcare policy makers. Let me say something about our education system. Our education system mainly focuses on students' memory rather than skill. Moreover, there is no vertical and horizontal integration of syllabus during the teaching. And at present, the need of the hour is we need to have problem-based training approach which our education system failed to bring out. And now the teachers. Teachers are someone, their commitment, their communication are highly rated in a medical system, medical education. There are many students who actually say that the teachers are the positive role models who had an encouraging impact on them. Teaching, which was once known to be a passion, has now become a means of livelihood. And the present generation teachers are not trained as per the education training system. And haphazard nature of teaching, particularly during the clinical hours, has led to non-attendance by the students. The respect, which was an integral part of the classroom once, has now simply flown out through the windows. Now let me say about the students. The healthcare system is a branch where you need to have proper observation, correlation, and diagnostic techniques skill and decision making. But the present generation students are failing to acquire these skills because most of the students are spending their time in the library to study rather than learning it from the bedside or in their outpatient departments. Hence, they are failing to have a proper communication with the patients, poor diagnostic techniques, improper medication, which led to gradual rise of these medical errors. And now a note about these healthcare policy makers. The healthcare policy makers all around the world had failed to bring strict and stringent laws around the unqualified medical practitioners, improper documentation, and nurse to patient ratios. Okay, how do we overcome these errors? What do you think are the interventions? Medical error is something which can be kept a secret very easily, because we don't have any regulatory authority body to whom we need to explain about these medical errors. So the medical errors can be kept or dealt internally within the institutions as well as within the doctors. Whereas the aviation and mining industries have a specific regulatory authority body where they report each death, each accident, and each phenomenon to the regulatory bodies. After that, these regulatory bodies make a proper investigation, analysis, and bring out the required changes to overcome these errors. So don't you think is it time for our medical system to bring a specific regulatory bodies to which the doctors need to report these errors and improve the patient's healthcare? The second one, the most of the capturing systems or the capturing codes of the death certificates does not have a specific capturing software to record the causes such as communication breakdown, diagnostic errors, improper techniques, whatnot, everything or sort of these errors. And only the underlying cause of the patient. Suppose the underlying cause may be the condition which made the patient to come to the hospital and to seek the treatment has been counted as the cause of death, even though if it is not fatal. Therefore, the actual impact of the medical errors is not known to the public. This led to failure of public attention as well as the failure to invest in the research. I totally agree. It would be an embarrassing situation and it would be unfortunate for a doctor to report to say that a patient had died due to a medical error. Moreover, the problem would not be solved if you start adding a checkbox to your death certificate. So what should we do? The main and the most important thing is that we need to educate the doctors, bring the awareness about the reporting of these errors, so that this is a public health problem and this reporting has to be done for the sake of public. If we do these things, then there would be awareness over the public, and also the healthcare policy makers, health workers would focus their attention, which would improve the resources for research in these areas. And not to forget about the system of education. There's inflation of the marks in the present education system. The so-called honors, gold medals or something, which were once a very special thing, has now become puppets in the hands of students. Hence, the need of the hour is to immediately make the required changes to the evaluation system, make a proper education examination transparent system, which should be fair, which should be very good, so that it would provocate or make the students to read, the anxiety, the enthusiasm among the students. And let me ask you one last question. Why did you choose to become a doctor? Because some do this for name and fame, some do this for parents, some do this for family, and there are some who do this for self-satisfaction and passion. Answer yourself, because every one of us would go through one of the worst phases in our life. And at that point, some of us would know, okay, we have lost our way, but still move in the same wrong way. And there are some who would know, okay, we have lost our way, they recreate themselves, they reinvent themselves, and they bring themselves back on to the track. That is what life is all about. You need to reinvent yourself, you need to recreate yourself. I'm saying you this again, this is not about shame and blame, but this is all about changing the game, because medicine is not just a profession, medicine is a passion.